so in this video, I'm going to be taking vital signs. So to begin, you want to walk into the room, you want to introduce yourself to the patient and let them know who you are, stuff like that. Hello, Mr. Goldstein. My name is Peyton James. I'm the student nurse today, and I'm going to be taking your vital signs. Is that okay with you?
Yes.
Okay, awesome. So you also want to make sure you ask the client if they've ate or drank anything or they've exercised recently, because that could mess up the vital signs, getting the accurate number. So have you? No? Okay. You want to make sure you secure privacy, make sure the curtain's closed so they don't feel violated. And then at this point, you also want to make sure you do hand hygiene for 20 seconds. Okay? So after this, we're going to do counting the radial pulse. So you want to start off, you're going to count it for 30 seconds, and then you're going to times that by 2. So I'm going to start right now. Okay, and I got 66. Okay, so after this, you're going to be checking the respirations. Normally, you would not be telling your client that you're going to check their respirations so their breathing doesn't change. So you're going to leave your arms on the radial pulse and checking the radial pulse, and you're going to be watching the respirations. And you're going to do it for 30 seconds as well, times that by 2. Respirations were 18. So now at this point, we're going to be doing blood sugar. Okay, so when you're doing the blood sugar, you want to make sure that the arm is bare, sleeve is up, that they aren't wearing a long sleeve shirt, anything like that. You're going to lay the arm on the table, rest, and have the palm up, just like that. And you want to make sure that the cuff size fits the patient correctly. The cuff should be 8% of the arm, and that there should be 2 inches between the brachial artery and the cuff. Okay, and you want to make sure the meter shows so you can see the numbers. You want to palpate the brachial artery. Okay. And you're going to take the stethoscope. And you're going to place it on the brachial artery. So then you're going to inflate between 180 and 200 at the highest. And then you're going to deflate the cuff. The systolic was 120, and then the diastolic was 80, so 120 over 80. Okay? So you're going to deflate that. Have that. So now at this point, we're going to, we're going to do the atypical pulse. So the atypical pulse, it's going to be metatarsal space, left fifth intercostal space, ventricular. Left ventricular, sorry, I'm like trying to like do it on my body. Okay. So it's gonna be right here. And then you're gonna count this for 1 full minute. I got 65. Okay, so now at this point, we are going to palpate the peripheral arteries. Can't say the word right. Sorry. Okay, so we're going to start with the carotid artery, and that's going to be right here. You want to make sure you do it one at a time so you don't choke the person out. And then we're going to do the femoral artery, and that's going to be right here. Okay, and the patella, it's like underneath the patella. It's going to be right here. Okay, and then you're going to do the posterior tibular pulse right here. And then you would have their foot off, their shoe off for this, and their sock off. And then this is the dorsal tibular pulse. And it'd be right there.